Hey everyone! So, if you're getting ready for your infant care certification, you already know there is a ton of information to remember. In this explainer, we're going to cut right through all that noise and zero in on the absolute must-know facts you need to pass your state exam with flying colors.
So, what are those core concepts, right? The ones that are really going to show up on the test. Let's dive right in and get you feeling prepared, confident, and totally ready to pass. Okay, here's our game plan. First, we'll talk about the postpartum parent, what's totally normal, and then what's a serious red flag. After that, we'll switch over to the infant, looking at common little issues versus real emergencies. And we'll wrap it all up with the essential hands-on care and safety rules that you're going to use every single day. Let's do this.
First up, let's talk about the postpartum parent. To really nail this on your exam, you've got to have a rock-solid understanding of what's just a normal part of the healing process, and maybe even more importantly, what isn't.
You know, a new parent's body goes through some incredible changes. You can bet you'll see questions on these 4 topics. First, there's lochia. That's the postpartum discharge, and you need to know that it changes color over a few weeks as the uterus heals. Then there's perineal discomfort, soreness from the delivery. Breast engorgement is another big one. That's when the breasts get full, firm, and tender. And of course, fatigue. We're talking about a level of tired that's just off the charts, thanks to hormones and, well, not sleeping.
Now, emotionally, you absolutely have to know about the baby blues. These are those feelings of sadness and anxiety that hit a lot of new parents. It's really common, but the key word here, the one you need to circle for your test, is temporary. And you're about to see exactly why that little word is so important.
Okay, so now let's flip the coin and look at the other side, the red flags. These are the critical warning signs that you have to be able to spot in a second and report immediately. This is where your knowledge can literally save a life. And here it is. This is where that distinction we just talked about becomes absolutely critical. The baby blues, they go away on their own. But any thoughts of the parent harming themselves or harming the baby, that's a whole different world. That's a sign of a serious medical emergency, like postpartum depression or psychosis. Knowing that difference isn't just a test question, it's a core part of keeping everyone safe.
All right, here's a number you have to burn into your brain. A fever of 100.4 degrees Fahrenheit, or 38 Celsius. That is a major red flag for a postpartum infection. And it means you need to get a medical professional on the phone immediately.
And here's another magic number to lock in. If a new parent is soaking through more than 1 sanitary pad in an hour, that's considered heavy bleeding. It's a sign of a possible postpartum hemorrhage, which is a really serious complication. So again, you report that right away.
And don't forget these 2 big ones, a really bad headache that just won't quit or any changes in vision. That could be postpartum preeclampsia, basically dangerously high blood pressure. And pain, swelling, or redness in just one leg could be a sign of a life-threatening blood clot. You're definitely going to want to have these memorized.
All right, let's switch gears and focus on the baby. We'll start with a few common things that usually aren't emergencies, but you still need to be able to identify them and, help new parents not to panic.
You can almost guarantee you'll see these on your exam. Cradle cap. It looks kind of like oily, scaly patches on the baby's head. Diaper rash. We all know what that is. That redness from being wet. And mild jaundice, which is a little bit of a yellow tint to the skin as the baby's liver gets going. For the test, just remember these 3 are super common, and they usually clear up on their own with just some basic care.
Okay, now we are moving into what is probably the most critical part of infant care, knowing for sure when a baby is seriously ill. This is a skill you have to have down cold because infants can get very sick very fast. These are the absolute, non-negotiable red flags. Any fever in a newborn is treated as a serious emergency, period. If they're having trouble breathing, look for flared nostrils or listen for grunting sounds. If they're refusing to eat, that's a huge deal. Forceful vomiting, I'm not talking about a little spit up, I mean projectile, can be a sign of a blockage. And if a baby is way too sleepy or you can't wake them up, that can mean a serious infection. Any one of these, you report it immediately.
Dehydration in a baby can happen scary fast. So the 2 classic signs you have to know for your exam are these: fewer than 6 wet diapers in a 24-hour period, and a sunken fontanelle. That's the soft spot on the baby's head. If it looks like it's dipping inward, that's a big sign they're dehydrated. Okay, last section. Let's get into the practical, hands-on stuff that you'll be tested on. These are the core procedures and safety rules that are really the foundation of your day-to-day work.
A huge topic on your exam is going to be sudden infant death syndrome, or SIDS. And let me tell you, knowing how to prevent it isn't just for the test, it's one of the most important parts of your job as a caregiver.
And this quote right here, it really says it all. The Safe to Sleep guidelines are proven lifesavers. They're not just some nice suggestions. They are the absolute best practices, backed by science. You need to know them inside and out, for the exam for sure, but way more importantly, for your entire career.
So here they are, the 5 golden rules of safe sleep. 1. Always, always, always put a baby on their back to sleep. 2. The sleep surface has to be firm and flat. Anything soft is a risk. 3. Keep the crib totally empty. No blankets, no pillows, no bumpers, no toys, nothing. 4. Make sure the air is smoke-free. And 5. Don't overdress the baby. We want to avoid them getting dangerously overheated.
Safe bottle feeding is all about getting the little details right. Always follow the formula instructions perfectly. Never, ever use a microwave to warm a bottle. It creates these hidden hotspots that can badly burn the baby's mouth. The best way to check the temperature is just a quick splash on your wrist. And always hold the baby in a semi-upright position so they don't choke, which is exactly why you never, ever prop a bottle up.
Burping seems simple, right? But it's so important for releasing all that swallowed air and keeping the baby comfortable. You'll need to know the 2 standard ways to do it: holding the baby up over your shoulder or sitting them upright on your lap and just gently patting their back. Okay, here are 2 more common procedures you'll need to know about. For the umbilical cord, the goal is super simple. Just keep it clean and dry. Fold the diaper down so it's not rubbing on it and it'll fall off on its own. For circumcision care, the focus is on keeping the area clean and then applying a little bit of petroleum jelly with each diaper change so nothing sticks. So, when you boil it all down, what's the bottom line? This quote says it perfectly. Your number 1 job, the absolute heart of this profession, is to keep that infant safe. Everything else comes second to that one huge responsibility.
So as you finish studying, just keep this question in your head. Because look, knowing the facts is one thing, but using that knowledge every single day to protect a new parent and child, well, that's what this is all about. You can do this. Good luck.